JICA supports building an effective maternal and child healthcare system based on Japan's experience and the expertise acquired through JICA's activities. In its cooperation, JICA emphasizes the continuum of care, which treats maternal, newborn, and child health care in an integrated and seamless manner in terms of 2 dimensions. The first dimension of the continuum of care is time. Caregiving is connected across time from pre-pregnancy through pregnancy, childbirth, and the early days and years of life. The second dimension of the continuum of care is place. Caregiving is linked with the various levels of home, community, and health facilities. Maternal and Child Health Handbook, the so-called Mch Handbook, is one of the tools which promote the continuum of care. Indonesia has one of the highest maternal mortality ratio in the ASEAN region. With the support of JICA, the project had been implemented to improve maternal and child health through the utilization of Mch handbooks. People in Japan are very familiar with the Mch handbook, but efforts need to be made in order to introduce and establish the use of the handbook as a system in other countries. It's essential to create a handbook that's suitable for mothers, one that is also based on the services available in that country. This is the Mch Handbook used in Indonesia. It can be used to keep records in households. It has a lot of illustrations and diagrams so that mothers can understand easily, and healthcare providers can use it as a job aid for health education. I received my handbook at the health center when I went for a prenatal checkup. It contains the record of my baby's birth and the health of both me and my baby. It comes in handy after birth as well. It's my guidebook on childcare. Mothers' awareness on health is raised by using the Mch Handbook from pregnancy up to the child's 5th birthday.
Most of the mothers who come to our hospital bring their Mch handbooks. The handbook is helpful for us, the medical staff, as well.
Maternal and child health services are provided by a wide range of healthcare providers. In order to have the Mch Handbook widely accepted, it's important for these healthcare providers to be able to use the handbook properly. Therefore, the project has not only distributed the handbook, but also provided training to the healthcare providers on how to use the handbook effectively. The Indonesian government has also been making efforts to sustain the Mch Handbook implementation. A ministerial decree on the handbook was issued in 2004, which provided a solid foundation of a special budget for the Mch Handbook. Decentralization has encouraged local governments to come up with their own initiatives. Let's look, for example, at the case of the Trenggalek Regency of East Java Province.
In this regency, mothers are asked for a contribution to the printing of the Mch Handbook. We plan to continue printing by using those contributions.
JICA's support has led to the spread of the Mch Handbook throughout Indonesia. Now it is being put to use effectively in each region. The Mch Handbook will help realize a continuum of care only when families, communities, and health facilities, including hospitals, use it effectively. Indonesia keeps striving to improve its reproductive health services with the Mch Handbook. The approach towards continuum of care differs from country to country. Syria in the Middle East had a challenge in getting more pregnant women to take antenatal and postnatal care at primary health facilities. The Manbij district in northern Syria. Here, JICA implemented a project to increase the utilization of reproductive health services provided by health centers based on the experiences of neighboring Jordan. The project aimed to encourage women to have antenatal and postnatal care at health centers by enhancing the community's awareness and knowledge of reproductive health. Therefore, the project began with the training of community health volunteers who would serve as a bridge between each health center and the community. Community health volunteers visit each family to explain the signs of pregnancy complications and the importance of having antenatal and postnatal care. The volunteers also inform people in the community about the services available at the health centers. It is not enough to simply raise the community's awareness and increase the demand for the services provided by health centers. The services have to be of good quality to serve for the increased demand. In order to improve the quality of service, the project focused on developing the technical and managerial capacities of health center staff. Midwives receive training in maternal care and family planning. Meanwhile, doctors participated in training programs that focused mainly on capacity development of management. The training sessions and regular supervision by governorate and district personnel helped enhance both the skills and the motivation of health center staff. They then went back to their respective health centers to put their training straight into practice.
Before the project started, we had several problems in the health centers. For example, many of the staff were not eager to provide services, and we didn't know how to handle health statistics. Thanks to the project, the staff's performance and their attitude have improved.
The midwives and staff are very kind. I'm very grateful to them. The project has helped increase the number of pregnant women who have antenatal care at the health centers. Although there are still challenges to address, Syria is one step closer to realizing a continuum of care. JICA will keep supporting the area of reproductive health so that people can deliver and rear children in an environment with ease.